merely absence of disease or infirmity. That means there are three components for a complete health, that is physical, mental, and social. Physical is your body and mental is your mind. When your mind and body will be in balance, your social health will automatically come in balance. So that is the reason we are talking here about mind body intervention. I'm specially focusing on pregnancy because of two very important reasons. One, pregnancy, there is two lives involved, one the mother and second the baby, right? And second important thing, during pregnancy, because of the release of hormones to maintain the pregnancy in the woman, like estrogens, progesterone, beta HCG, the woman becomes vulnerable for mental illnesses like anxiety, depression, stress, right? So that's why we are focusing on pregnancy today. I'll just start my presentation. I'll show you certain data about why we have to focus on pregnancy, right? 1 in 5 women experience anxiety or depression during pregnancy or postpartum period. Postpartum means after the delivery of the child. Emotional well-being influences fetal development and birth outcomes. Holistic care includes mental, emotional, and physical wellness. I'll show certain slides so that things will be clear. Now, this is the data from US, wherein they say 1 in 5 women suffer from maternal mental health disorder like postpartum depression. And less than 15% of women receive treatment. Why? There are many reasons I have spoken in my previous presentation, like poverty, inaccessibility to health, or stigma attached to mental health. And very important, we are not able to accept that pregnancy is related to certain mental health disorders. That is a very important reason for receiving less treatment. Then 1 in 7 will experience depression during pregnancy. Up to 50% of women living in poverty will suffer from maternal mental health disorder. Again, why? Because they are not able to access food, proper food which they need in pregnancy. How are they going to access mental health or physical health services which are available? So they are at more risk of developing mental health disorder. Now, 1 in 10 dads also experience perinatal mental health disorder. Yes, men also suffer from mental health issues after the delivery of the child or when wife is pregnant. Again, I have spoken about this in my previous presentation, how men are affected during pregnancy or postpartum period. Anxiety and depression have risen 37% in teen girls. Now, what happens? These teen girls, when they will conceive, they were more prone to have anxiety or depression or any sort of mental health issue during pregnancy or in the postpartum period. More than 600,000 women will suffer from maternal mental health disorder in the United States every year. It's a very alarming figure. And not just moms, maternal mental health disorder impact the whole family, not just a woman. So here comes the social part of the health. If mother is not healthy, the child will not be healthy, husband will be affected, whole family, and thus the society will also be affected. So this is from US. Sorry, if I am audible, I have forgot to ask. I'm audible?
Yes, ma'am.
Okay. I'm not able to see you because I'm presenting. So if any query, just open your mic and. Now this is the data from Australia. Australia said 1 in 10 women experience depression in pregnancy. Now this is a bit different from US. It's different from every country. 1 in 7 experience depression after birth, and 1 in 5 women experience anxiety in pregnancy or after birth. Now, why should we focus on maternal mental health? Because pregnancy and first year after the birth are associated with increased risk of mental health conditions. And very important thing, suicide in the perinatal period is the leading cause of maternal death in Australia. This is a very alarming fact. Maternal death, causes of maternal death in Australia, suicide is the biggest cause. And early intervention reduces the impact of perinatal mental illnesses in mother, baby, family, and society in general. Now, coming about our India. This is the data. Antenatal common mental disorders 22%, post traumatic stress disorder 9%, perinatal depression 14 to 24%, and suicide 7.6%. Again, it is said that this data may not be fully correct because in India there are underreporting of cases, especially in rural areas. This was a news in NDTV Swasth Banega India in 2023 February 24. They said a woman dies of pregnancy related cause every 2 minutes, and most of these deaths are preventable. So, what are the pregnancy related deaths? US has published this data, which says between 2017 to 2019, see, most of the maternal deaths was because of the mental health condition of the mother. It was not because of high BP. We have heard बीपी शूट अप हो गया था प्रेगनेंसी के टाइम पे, इसलिए कुछ कॉम्प्लिकेशन हुआ, डेथ हो गई, या ज्यादा ब्लीडिंग हो गई थी, डेथ हो गई. एक्सेसिव ब्लीडिंग ओनली 14%, hypertensive disorders only 7%, and other things, infection and cardiac conditions, they vary, but the largest cause is 23% is mental health conditions, right? So that's why we are talking about mental health conditions. In fact, in 21, WHO has launched a guide, perinatal guide, wherein they have said, like how we are, our ASHA workers or Anganwadi workers are involved in providing basic care to antenatal mother, like food and nutrition, immunization, and checkups. They should be trained to deal with the mental health conditions of the woman. Also, WHO has issued a guideline for this. Now again, this was from UK. They said suicide is the biggest cause of death for women during pregnancy and first year after birth. And here US has further divided into which is the period when most of the deaths occur. Like 62% of the pregnancy-related suicides occur between 43 to 365 days postpartum. That is 43 to 365 days after the delivery of the child. Most of the suicides occur during that period. 24% occur during pregnancy, and 42% occurs 14% occurs 42 within 42 days after the delivery. So this is the data about suicides during perinatal period. And of course, this they have published. CDC has they have done a research in 36 states of US, and they said pregnancy-related deaths from suicide are 80% preventable if you diagnose it in early stage and you provide proper treatment and management. You can prevent 80% of the suicide during perinatal period. So perinatal period is from the time the lady conceives until 1 year after the delivery of the child. That is around a period of approximately 1 year and 9 months. Okay, that was about the data, so that you are more clear and more into it that why should we be talking about mental health, because it's a new concept, mental health during pregnancy. Now, what happens if mother is mentally sick or the lady who is pregnant is mentally sick? She has a poor mental health. What happens? During pregnancy, she will not be able to take care of herself. She may not have adequate nutrition. She may not go for her regular antenatal visits. So there is a chance of preterm birth, low birth weight baby, or there is a high risk of preeclampsia, that is high BP during pregnancy. Now, what happens after delivery? She may not be able to feed the baby properly. She may not be able to form infant bond, mother-infant bond properly. She may not be able to take care of the baby. Now, when this baby reaches infancy, he may have low birth weight. He may be not having exclusive breastfed, and there is disruption in maternal-infant bonding and attachment. Very important. If maternal-infant bonding or attachment is not formed properly, this child will have trust issues in his later life. He may have issues in trusting other people because he was not able to form a maternal-infant bond with his mother because mother was mentally sick. Now, as the child grows, he may have stunting, he may be underweight, he may have poor cognitive development, lower immunization rates, and as this child reaches adolescence, he will be at high risk of developing mental health issues. Most of the mental health issues they flare up during puberty. So this child is again going to have mental health issues. Now this child, whether a boy or girl, if she is a girl and she conceives, the same cycle will go on. And the generations will have some sort of mental health issues. This is known as ripple effect of mental health disorders in mother, which passes on to generation. And if he is a boy, the father will not be of like father will not have a adequate mental health, or he will have some sort of mental illness. Again, this will affect the child. Again, I have spoken about it in my previous presentation. So now this brings us to water body mind intervention. Okay, the interventions I'm talking here about is for everyone, but I will specially connect it with pregnant women. This anybody can do who wants to have a balance between mind and body. So what are body mind interventions? They are basically techniques that connect your mental health with your physical health. And what are these? Yoga, meditation, mindfulness, guided imagery, and breath works. That is pranayama. And aim, what is the aim? It is to reduce stress, anxiety, and improve overall emotional balance. So we'll see these one by one. Yoga. Of course, prenatal and postnatal yoga in itself is a very big topic, so I have not touched upon it. I'm just talking about the safety measures one should use while pregnant, while performing yoga during pregnancy. First and very important thing, if you have been doing yoga before pregnancy, you can continue your yoga, but exception, you have to make few exceptions, which there are certain exercises which you cannot do. But if you are starting yoga while you are pregnant, it's always better to take a prenatal yoga class, or online or offline. Today, nowadays, online classes are also there. So you can choose a prenatal yoga class, expert from antenatal yoga, postnatal yoga. Always focus on gentle stretches and pelvic floor exercise. Why? Because during pregnancy and for labor, you need to strengthen your pelvic floor muscles. So you focus on these exercises. Avoid poses that compress the belly. Try not to do any pose which is compressing the belly, because there is a womb and a baby is growing inside it. Modify balance-based poses, of course. Many poses will have to be modified as per the trimester in pregnancy. So you should talk to an yoga expert while you are doing yoga in pregnancy. Emphasize breath awareness and relaxation. Between yoga, when you have to breathe in, when you have to breathe out, when you have to relax, this is very important while you are doing yoga. Whether you are pregnant or not, you have to be aware about your breathing pattern during yoga. So now, what are the benefits of yoga during pregnancy? It enhances physical flexibility and strength. It reduces lower back pain and fatigue during pregnancy, especially as the pregnancy advances, because of the growing womb, which poses pressure on the back. Often ladies complain of lower back pain and easily fatigued because there is lots of energy which the baby is consuming, so she gets tired easily. Yoga will help with both. It will help in reducing the back pain, and it will help you in dealing with your fatigue. Then it boosts circulation and relaxation. It will improve mood and reduce cortisol. Now, during pregnancy, there is lots of cortisol release also, because your body is under stress because of the changes happening in the body, because of the hormones released in the body. So, yoga will help in reducing the cortisol amount. And this cortisol, as the cortisol reduces, your stress will automatically reduce. And it has been proved that mothers who are stressed during pregnancy with lots of cortisol in their body, the mind of the body is affected during development. So mother should be relaxed during pregnancy. And of course, it promotes better sleep and body awareness. Okay, now this is a book which was published by Speaking Cube. If you want to learn more about yoga, which exercises you should do, which you should not do, or anything about perinatal mental health, this book is available on Amazon. Now coming to pranayama, breath work, the power of pranayama. We have often heard if you're angry, आपको गुस्सा आ रहा है, लंबी गहरी सांसें लो. And many, if you have been following many relaxation techniques, you must have seen that we start with deep breath. Inhale deeply, exhale out, inhale deeply, exhale out. So what are we doing when we are inhaling and exhaling? The breaths are bridge between mind and body. So when you inhale deeply, slowly, and when you exhale deeply, slowly, your mind gets a message. Okay, now you calm down. You don't have to be stressed. You don't have to be fear about it. So your mind is getting the message, okay, I have to relax myself. So breath is the bridge between mind and body. Very importantly, during pregnancy, it helps in management of pain, anxiety, and labor stress. Now, what happens? Especially, the breath work is taught to women who is about to deliver. During labor process, you must have heard labor pain is one of the severest pain in the whole world, right? So, what happens? Those who are mm, adapt with this technique, they can go through this smoothly. They teach how to inhale and exhale and how to keep yourself calm during that labor phase. Because labor stages are different. Some lady may take 2, 3 hours. Sometimes it may progress to 6 hours, 8 hours. If you know the proper breathing technique and if you're able to relieve your pain, anxiety during that labor period, your labor will go smoothly and the chances of normal delivery are more. Again, with yoga and with breath work, the chances of normal delivery increases. So this is very important to learn during pregnancy, especially if you're planning for normal delivery. So what are the common techniques or breath work or pranayama during pregnancy? Or we can do it, not those who are not even pregnant, they can also do it. Just during pregnancy, these are little bit modified. Like Anulom Vilom. We all know Anulom Vilom. We pinch our nose, like we have to hold it like this. We pinch our nose, one nostril. We inhale from left nostril, then we pinch it, and you can hold it for as long as possible. Exhale from right nostril. Again, inhale from right, hold the breath, exhale from left. But during pregnancy, there is a modification. You don't have to hold the breath. Inhale from left nostril, exhale from right. Inhale from right, exhale from left. Don't try to hold breath. Now coming to Ujjayi, that is victorious breathing. This is simple breathing, normal, like I'm sitting in a Sukhasana or Padmasana position and I'm inhaling and I am exhaling. But there is a mind work. This comes with practice. When you inhale, you have to think that there is a hole here in your neck. And you have to imagine that you are breathing from it and you are exhaling from it. So when you practice it, there will be a hissing sort of sound will start coming. That is Ujjayi or victorious breathing. Again, this helps in relaxation. Deep belly breathing, also known as diaphragmatic breathing. Pregnancy, as the pregnancy advances, deep belly breathing is not very common. You should do it in early stages of pregnancy. Now, coming to mindfulness in pregnancy. So, what is mindfulness? Mindfulness is basically you have to be aware of your present situation or present moment with the non judgmental attitude. Being fully present with non judgmental awareness. I am sitting here now, I am taking this webinar, I am aware of it, but I am not judging anything in this environment or in this webinar, and I'm just listening or I'm just delivering the speech. I am not judging anybody or anything here. That is mindfulness. How does it help? It helps in emotional regulation and reducing negative thoughts. It encourages deeper connection with baby and self. So there are various techniques. When we learn about it, these things will be more clear. So what are the techniques? Body scan meditation, loving kindness meditation, also known as metta, journaling and gratitude practice, mindful walking and eating. So let's see these one by one. Body scan meditation. This is again a very common relaxation exercise which we use as a psychotherapist for our clients when we want to relax them, right? So what is it? It is a mindfulness practice that involves systematically bringing awareness to different parts of the body, noticing sensations without judgment, and cultivating a sense of presence and acceptance. This is a way to reconnect with your body and become more aware of your physical and emotional state. So, how do we do it? First of all, you have to sit in a comfortable position. You can lie down also. If you are pregnant, if you are lying down on a couch, always support your back with adequate pillow. And you don't have to lie down flat on bed, especially during last trimester of pregnancy, right? Otherwise, normal people they can sit down in Padmasana or Sukhasana or they can lie down. Close your eyes. First, take 3 deep breaths. Inhale and exhale. Now, again, why breathing? To calm down your mind because already so many chaos is happening around us. Our mind is always in a chaotic state. So, to calm down and preparing yourself for the next step of meditation, deep breaths, 3 deep breaths. Now, closing your eyes, taking three deep breaths. Now, starting from your head, bring your awareness to your head. Just feel your head, be aware of your head, and notice the sensations in your head. There may be anger, there may be happiness, there may be fear, there may be anxiety, there may be guilt, any sort of emotion. There you may feel anything, tingling sensation, hot, cold, anything you can feel. Just be aware of it. Don't judge it. Okay, my mind is hot. Yeah, I'm feeling anxious because of this, because of that. This happened. Then nothing. Just feel the sensation. Be there for 20 to 60 seconds and release all the tension, whatever you are feeling. Then move to next body, like forehead. Again, same. Feel the sensations. Don't judge it. Don't attach yourself to it and release it. Then to your eyes, nose, mouth. This way you go down to your toes and you feel the sensation in each and every part of the body. And you can see some you many people have seen like they say कि हमें लगा कि हमारे हार्ट में बहुत सारा गुस्सा भरा है या हमें हमारे माइंड में बहुत सारा एंगर फील हुआ या बहुत खुशी फील हुई या एंजाइटी फील हुई in a particular part. Some people may not feel it, but at the end of the uh, meditation, body scan meditation, they felt that their whole body and mind is relaxed. So I'll be taking a workshop on how to do a body scan meditation. I will soon launch posters for it. Proper body scan meditation where you will be doing a body scan meditation and seeing it different. Next technique is loving kindness meditation, that is metta. Now, metta is actually originated from a Buddhist tradition, and it is a practice of which is focused on cultivating feelings of kindness, compassion, and well-being towards oneself and others. And what it does, it fosters positive emotions like love, compassion, joy, and gratitude. Now, what happens? We most of the time forget to um think about ourselves. We are thinking about I'm a mother, I'm thinking about my child, I'm a wife, I'm thinking about my husband. Like I'm thinking about my job, my boss, my workload, everything, but I forget to think about myself. I forget to think how should I keep myself happy, how should I keep myself healthy. So this meditation teaches you to take care of yourself, then to take care of your people around you and everywhere in the world. So it's basically you have to sit in meditation, and this is a sample which I have just shown here. You have to say, may I be happy, may I be peaceful, may I be well, may I live with ease. This is for yourself. You come first in this because if you are not happy, peaceful, or at ease, you will not be able to make others happy or peaceful or at ease. So you have to be first happy and peaceful. So next step is, may you be happy, may you be peaceful, may you be well, and may you live with ease. So first one was for myself, second one was for you, and then for everybody. May all be everywhere be happy. May they be healthy. May they be at peace. May they be free. Now, what happens when you pray like this? There is a flow of positive emotions which makes you feel very good that you have prayed for yourself, you have prayed for others also. So this uh, clears the positive emotions inside you and you feel automatically calm and happy. And when you say this to yourself every day, may I be happy, may I be happy, you automatically start feeling happy and you start doing things which make you happy, right? Otherwise, today's busy world, we don't do many things which makes us happy, like simple drawing or going out somewhere. We don't have time for all those things. So you will start doing things which make you happy, right? Now, next is journaling, a very important technique. Again, we use this technique very often in our psychotherapies. What is journaling? A practice of writing down one's thoughts, feelings, experiences, and observations. It is a form of self expression and self reflection that can be a valuable tool for improving mental health, increasing self awareness, and processing emotions. It helps with managing stress, anxiety, and depression by allowing individuals to process their emotions, identify negative thought patterns, and develop coping mechanisms. So now what is journaling? If I'll put it simply, writing your thoughts on a piece of paper or in a diary. But actually, it's not that simple. Again, of course, I will be taking the same workshop. We'll be talking about how to do journaling properly because it's very important. You don't have to write anything. You have to write the correct thing so that it will release your emotion. It will help you release your emotion. So many times it happens we are not able to release our emotions, and the pent up emotions inside us gives us stress, anxiety, or anger, and suddenly we burst out one day, right? So journaling is a very good tool जब आपके पास कोई नहीं है अपनी फीलिंग शेयर करने के लिए, या you are scared to share your feelings, सामने वाला समझेगा नहीं, or any reason means you are not able to tell any others. It may be something which you're guilty of. You can't share to anybody, right? So if you write down those thoughts in your journal, in your diary, automatically you have taken out that from your mind and you have written in a paper. So automatically that thought, half of the burden is gone because you have written it out. It has come out from your mind, right? So you will automatically feel less burden because of that. Now, when you are at peace, if you read that thought or that particular incident, you may find things which you can see, okay, this thing was not in my hand. I have done something which I'm guilty of today. I'm still guilty of something which I have done in past. Now, when I wrote it down today and when I'm reading it peacefully, I found that no, it's not my mistake. I was not in that time, I was not in that mental state, or I was not that grown up to understand the thing and behave in a proper manner, right? So you automatically feel less burden, or you may come out of that state. So same way, when we tell our patients, अब अपने एक हफ्ते का जो भी incidences है, which like suppose anger management, last 1 week, whatever situation you have faced which has made you made you angry, you write it down on your diary. Once a week you have written. एक week के बाद when you look back, you may see कि बहुत सारे incidences ऐसे थे जिसमें आप just you got angry because you assumed something and it never happened. You were overthinking or you were cooking up things, but the things actually never happened. Or like there were certain things you can do to avoid those and those particular situations, or you can avoid being angry at those situations, and those situations could have been handled properly. So this gives you a self reflection into your actions. So this is a very important tool which we tell our patients to do journaling so that we can see what are the emotions they are going through and they will automatically learn how to manage it. Okay, now coming to gratitude practices. So this is basically cultivating an attitude of thankfulness and appreciation for the positive aspects of life, both big and small. Most of the time what happens, we see किसने हमारे साथ क्या गलत किया, या किसने हमारा कोई काम हमने बोला नहीं किया, and so many things, but we don't see कि उसने हमारे लिए कुछ एक चीज तो कर दी थी, and we don't thank him for that. Many time it happens, so most of the time it may happen. So what happens, we see things which uh, we feel he has done wrong, which we don't see what good he has done. If we'll see the goodness, we'll appreciate it, and if we'll appreciate it, we'll have a positive feelings towards it, right? So what are the common gratitude practices? One, journaling. You can write a gratitude journal. Or gratitude jar. You can make small slips, whomever you want to thank. You can put it in that jar, and you can anytime you can take it out and you can read and you can just enjoy it. Expressing gratitude verbally, you can thank if you have felt like somebody has done even a small good thing for you. Just give them verbal appreciation or thank you notes. Mindful practices. There is a meditation known as gratitude meditation. It's like loving kindness meditation, which we have just done. We there we say thank you to all the people. Like I thank my mother for taking care of me till till this time. I thank my father for providing me all these things. I thank my husband for all these things. I thank my child. He listened to me today, or he did this thing today, which I told him. So you that is gratitude meditation. And body scan again. The we have done a body scan meditation just now. We can do it with gratitude practice also. Like we pray gratitude to our organs for being healthy, for working for us all the time. Then visual reminders, post-it affirmations and gratitude affirmations. You can post the affirmations. These are the examples of affirmations. I have taken the pregnancy affirmation because we are talking about pregnancy. You can say, I appreciate the changes taking place in my body. What happens? Many women are stressed because of the weight gain in the pregnancy, because of the bulging belly, because of the butterfly marks that appear on cheeks of the woman, or because of the stretch marks. So when you appreciate the changes in your body, you will not be feeling worried about the change. I am grateful for the new life forming within me. I give thanks for this pregnancy. I give thanks for the chance to be a mother. Today I am grateful for living, breathing, and carrying a new life inside me. When you say such affirmations to you every day, you feel a positive strength inside you to carry out the pregnancy in spite of all the problems you are facing in your pregnancy. So your body becomes more powerful to carry out the pregnancy, and your mind also becomes powerful to support the pregnancy. Okay, now I've just included this. It's a very important thing which I generally talk in all my presentations. Talking to your baby is a very important thing. After 20 weeks of pregnancy, your baby will be able to listen to your voices. So very first, very important thing, never shout in front of the baby. Nobody should be allowed. Fathers, mother-in-laws, anybody don't shout in front of the pregnant lady. Especially after 20 weeks, the baby is listening, right? And the baby gets stressed because of it. So don't shout in front of the baby. Speak softly. Keep your voice steady and slow. The mother can stroke the tummy, sing softly, read. Father can be involved. If there is a sibling, they can also be involved. See, when a baby is born, when the mother takes him in hands for the first time and says something, baby knows she is my mother. Why? Because he has been hearing her. He has been feeling her. Right? Again, those fathers who are involved like this, who talk to the baby will be able to recognize the fathers also very easily. So if you're talking to the baby will be able to recognize everyone because they are listening. And of course, this talking helps in development of the senses of the baby. If you chant, many nowadays you see videos, 6 months or less than a year old babies are chanting mantras. Why? Because the mother was listening to the mantras and she was chanting the mantras all throughout the pregnancy. I will just say my example. I used to chant Om Bhu Varsva to my baby, and he was a preterm. He was in NICU for a month. I used to chant this. Very easily, he learned that mantra. He just, when he was 2 years old, he can chant that mantra without any help. So, this is how they learn when in the womb. Like, we have a famous story of Abhimanyu who we heard कि वो महाभारत का वो चक्रव्यूह कैसे तोड़ना है. So actually that is not completely wrong. Babies listen and they learn. And it's said, Garbha Sanskara workshop, they give you activities, puzzles to enhance the brain of the baby. If mother is solving puzzles, it will enhance the brain of the baby also. If mother is doing lifting, mother is doing drawing, everything will impact the brain development of the baby. And same way, if mother is stressed or anxious, it will also affect the brain development in a negative way. Now coming to mindful walking and eating. And this is very important for those who want to reduce weight. Mindful walking involves paying attention to the sensations of your body as you walk, you breathe, and your surroundings. It's basically like आजकल हम how do we walk? We put the headphones in and we just walk. हमें नहीं पता हमारे surroundings में ज़्यादा क्या चल रहा है. It's one of the reason is because we don't have places where it is like big parks where it is silent. It will be like horn sounding and pollution and everything. So that is the reason we do this. But if you have a place which is close to nature, like jungle sort of, or a park which is uh, you can just it's a quiet park. Just walk on the grass barefoot. Feel the sensations of the grass. Just listen to the air. Listen to the birds chirping. Feel the air with your skin. Right. Whatever you are doing, you have to feel your surroundings. See the flowers. Admire the color of the flowers. This all will help you in calming down your mind. You are just not walking and making your physical body strength. You have to when you are walking mindfully, you are calming down your mind also. You are working for your mind also. Mindful eating, of course. What happens in mindful eating? Whatever you eat, uh, you're just not eating randomly anything. First of very important, you eat only when your body gives you hunger clues. So like many people eat, मैं stress तो इसलिए मैं बहुत खा रहा हूँ, मुझे बहुत गुस्सा आ रहा है इसलिए मैं खा रहा हूँ. What happens? They become overweight, and then they are not able to stop themselves. When you are eating mindfully, you are practicing mindful eating. You will eat only when you are hungry, and you stop the moment you realize you are full. So you will not eat extra. Then what you are eating, that will be important. You will not eat junk food. You will only eat healthy food because you will think, okay, I can eat this. This is healthy for me, so I should eat it. This is unhealthy. This is not good for me. I will not eat it. So this is known as mindful eating. When you experience on each bite of food with intention, noticing tastes, textures, and your body's hunger and fullness. Of course, most important, you don't watch mobile or TV when you are eating. In mindful eating, most of us are in a habit nowadays. हम मोबाइल चला लेते हैं, टीवी चला लेते हैं. We keep eating, हमें पता भी नहीं हम क्या खा रहे हैं, क्या taste and water है उससे. So that is not actually very good for us. Okay, now this is our last therapy, which is guided imagery therapy. Again, we use this very commonly in our psychotherapies to relax the client. So what is a guided imagery? It's basically we create an image in your brain which you imagine and which gives you relaxation. Everybody can have their own script of guided imagery, whichever makes you feel calm or happy. So first of all, very important is you believe in the technique. Again, you have to sit comfortably, or you can lie down. Also for this imagery, again I'll say pregnant woman. If you are in last trimester, you lie down on a couch with your back supported properly. Even if you're sitting, sit in a proper place, because when you go into deeper into guided imagery, you should not fall off from your place. So sit in a proper place with properly supported. Now, in first, again, you have to do deep breathing and to calm down your mind from the chaos of the everyday life. And then your therapist will guide you a scene. Like sometimes, like what we use. I'll just give an example. After deep breathing, we'll say, now imagine that you are walking in a garden. See, the garden is green with full of trees, full of flowers, different colors of flowers. There is a soft grass in front of you. Walk on the grass. Feel the softness of the grass. Feel the dew drops on the grass on your feet. Now see that your favorite flower is here. Just go touch the flower, appreciate it, smell it. Now go deeper inside the garden. There is a fruit. There is a tree which bears your favorite fruit. Pluck the fruit. Taste it. Right? So we are engaging all your senses into something which is making you feel better. Your favorite flower, the smell of your favorite flower. Seeing your favorite flower is for your eyes. A smell for your nose. Listening to the breeze of birds chirping, your ears are involved. Now eating. You actually, those who do it properly, they actually feel the taste of that your favorite food, which will give you a sense of calmness and happiness. And this way it goes on. It is actually, if you do it properly, it can be for 15-20 minutes to half an hour. At the end of the scene, you actually feel relaxed because we try to involve all your senses in it. Your touch senses, eyes, nose, ears, all the five senses are involved and guided in every. And you just imagine that scene as if you are there, you are walking on the beach, you're sitting on the beach, you're seeing the sunset, anything. Like again, for pregnant women, we can make or we can adjust the scene with like, while I wait for your arrival of the baby, I imagine your face is like this, your eyes will be like this. I dream like I am having you in my arms, I'm thinking something to you, or I'm loving you with all my heart. These things help in relaxing the mother. So these sort of imagery we can produce. We can have our own scripts for different sort of patients as per the need of the patient. Again, okay. Now you may say ki I am saying all these things. What is the evidence? So this is the evidence. I have just quoted few research here from Alzheimer, from Harvard Medical School, which says that mindfulness, yoga, meditation, yoga, all these things, they reduce negative emotions during pregnancy. They improve the sleep quality. They improve the maternal and neonatal outcome. That is, mother developing complication during pregnancy or after delivery, and the baby. Because the mother has some issues, the baby will also have more chances of having certain issues, any physical and or mental health issues. So this relaxes the mother and the baby. It reduces the symptoms of depression, improves the maternal fetal attachment. See, I'm again talking about maternal fetal attachment because actually it's very, very important. This attachment is very important. Since the baby is in the womb of the mother, if the attachment is not formed properly, baby will have trust issues and many mental health issues in the later life. So forming this attachment is very important, right? Okay, now how to incorporate body mind practice? Most of the time हम तो बहुत बिजी हैं, हमारे पास टाइम नहीं है, हम क्या करें कैसे करें. Take out 10 minutes from your baby schedule, just 10 minutes for yourself, right? Especially when you're pregnant, you have to think of the baby. You are doing this for your baby. So at least for start with 10 minutes a day. You can use apps or if you don't have time to go out, go to a prenatal yoga session. Use apps and guided audios and video sessions. Plenty of them are available online, but just use the trusted one. You can have an online yoga coach. You can have an online yoga meditation coach, right? There are many Garbha Sanskara apps. We in Speaking Tube also we offer ladies many therapies, pregnant ladies, many advices, therapies and sessions which help them in um, going through the pregnancy journey smoothly. Join prenatal wellness groups. Again, this image I have shown, there is a Speaking Tube app we have which we have launched. It's available in Play Store. This app has many relaxation, uh, you can say relaxation techniques or like guided imagery techniques where you can listen to it and you can calm down. It's just quick for 5 minutes, 10 minutes sessions where you can just listen to it and you can calm down yourself. Then there are daily positive affirmations. There are certain games which you can just play on when you are feeling stressed and it will help you relax it. So this is a Speaking Tube app which is available on Play Store. You can always download it. And you always, of course, during pregnancy, try to find a trained prenatal yoga or mindfulness instructor because it's a matter of full. Okay, now, because of all this thing which I've told you in this presentation, why pregnancy, mental health is important. Speaking Tube has taken initiative and started free pregnancy mental health OPD. We are giving free consultation every Sunday 11 to 2 p.m. to pregnant ladies because there are many ladies who are not able to afford it. And very important thing, people are not aware that pregnancy may the woman is having anxiety, depression. Men can also have anxiety and depression. Like in our culture, it's a stigma. Mental health is a mental illness is a stigma. Still, we don't talk about it openly. प्रेगनेंसी के टाइम पे फीवर से अच्छा प्रेगनेंसी हु से प्रेगनेंसी में अरे ठीक है प्रेगनेंसी है थोड़ा सा एंजाइटी तो होगा इट्स नॉर्मल बट व्हेन इट इज गोइंग बियॉन्ड नॉर्मल यू शुड नो एंड यू शुड सीक हेल्प because it's a matter of the child and the whole family. So we have launched free pregnancy mental health OPD where we give individual counseling, supportive therapies, guidance for whole family. So I request you all just to tell people near you who are pregnant or planning to conceive or you are in this age group too. If they feel anything and feeling overwhelmed, anxious, or low during pregnancy, just you can have a free consultation. So to conclude, mind body intervention empowers mothers. They are low cost, accessible, and effective for mental health because there are many free apps you can join and you can do your yoga, meditation, and everything. And once you learn it, you don't need any app also. You can continue it on your own. Just you need motivation to start first and then to continue it. It's not for pregnant ladies, for I actually for normal people also. And it encourages healthcare providers to integrate holistic care. Now the concept of holistic care is coming everywhere, especially in mental health, because health is a combination of physical, mental, and social, right? As per the WHO definition. So this whole thing when they are healthy, all three aspects when they are healthy, then it becomes a holistic health. So you have to take care of all the three aspects, not only physical. फीवर है आपने डॉक्टर के पास गए आपने पैरासिटामोल ले लिया बट एंजाइटी है डिप्रेशन है कुछ भी है व्हाई यू नॉट टेकिंग or seeking advice you have to because mental health is also as important as physical health. Mental health illnesses start impacting your physical health also if it exceeds certain amount. So you should take care of both. Okay, this is about an upcoming workshop we will be releasing poster soon where we'll learn how to do journaling in a correct manner, body scanning meditation, and guided imaging. So these three techniques we'll learn. We'll be doing it properly how I have just introduced you today, but we'll do it a proper section of body scan meditation, guided imagery, and of course how to write journal. We'll soon launch the poster, so stay connected with Speaking Tools. So that's all for today. If you have any questions, you can ask audience. I hope you've understood things. It's actually important to take care of the mental health of the mother because mother and baby both are very important for the future also, right? So if there are any questions or we'll end the session here. Right, so Sneha, can you stop the recording? Sneha, are you there?
मैम मेरे ख्याल से वो लोग नहीं है.
Yeah, I just messaged her. Well, I'll just
अच्छा
end the
मैं
session. Thank you. Want to ask something?
यस मैम, मेरा एक सवाल था. जैसे कि हमने मदर के लिए बात करी यहाँ पर कि मदर की मतलब मेंटल हेल्थ को कैसा ख्याल रखा जा सकता है. वैसे ही अगर जैसे जो फादर होते हैं या फिर उनकी मेंटल हेल्थ का क्या, उनके लिए क्या किया जा सकता है. ठीक है, एक
Okay.
ये सवाल था. एक और सवाल था इसके बाद में. एक आप पहले मैम इसका बता दी.
Okay. See, सबसे पहले तो फादर को मेंटल हेल्थ इश्यूज क्यों होते हैं? वन वेरी इंपॉर्टेंट थिंग, जो हस्बैंड वाइफ का रिलेशनशिप होता है वो आफ्टर प्रेगनेंसी चेंज होने लगता है. वाइफ इज मोर फोकस्ड ऑन प्रेगनेंसी. पहले फोकस पूरा हस्बैंड होता है फैमिली. देन शी इज मोर फोकस्ड ऑन प्रेगनेंसी. देन जब बेबी कम्स आउट तो बेबी पे फोकस होता है. तो व्हाट हैपेंस जब the father when he starts realizing that my wife is not focusing on me or she is not taking care of me as she used to be earlier. And second thing, there are issues like he has to think of pregnancy में extra खर्चा होगा, financial कैसे manage करना है, how to take care of the baby after birth, delivery का खर्चा and education, मतलब so many. एक baby आ रहा है तो खर्चे बढ़ रहे हैं. Father may become anxious about all these things. And if he has any previous mental health issues, he may go. Many times, fathers have depressions also because he has a fear कि क्या मैं अच्छा फादर बन पाऊंगा, क्या
हम्म,
मैं बच्चे को वो दे पाऊंगा जो मैं चाहता हूँ, या जैसी एजुकेशन चाहता हूँ। मेरा फाइनेंशियल स्टेटस उतना अच्छा नहीं है, मैं बच्चे को स्कूल में पढ़ाना चाहता हूँ कोई इंटरनेशनल स्कूल में, पर मेरा फाइनेंशियल स्टेटस उतना नहीं है। So
हम्म,
sometimes these things make him feel depressed also. So anxiety and depression and stress, three main things which generally fathers face. उनके लिए same है. You have to give them psychotherapy, like guided imagery, and ये सब जो है ये relaxation exercises है. If he is okay after doing the relaxation exercises, it's okay. But अगर he is very anxious and very depressed, then there are psychotherapy sections wherein you have to make him accept the reality कि ठीक है आपका financial status इतना है तो आप कोई बात नहीं अपने बच्चों को स्कूल में पढ़ाइए, एटलीस्ट दिस इज ऑल्सो गुड स्कूल। ओके
हम्म,
आपको स्कूल नहीं है, और you work hard or you try to get a promotion, you try to switch job if possible, so that you earn that much कि आप अपने बच्चे को इंटरनेशनल स्कूल में भेजें। So there are therapies. These all things which we have learned today, they are basically for relaxation. These fathers can also do.
यस मैम, करेक्ट।
They are not relaxed with this, they can go for other psychotherapy. What was the second question?
ये हाँ मैम, ये मतलब सेकंड क्वेश्चन भी थोड़ा सा मतलब जो हमारा टॉपिक था आज का उससे थोड़ा सा मतलब डिफरेंट जा रहा है कि जैसे आपने उसमें बोला था, एक जगह पे बोला भी था कि एक टैबू की तरह है, एक स्टिग्मा की तरह है कि ये जो तो मतलब मेंटल हेल्थ तो ऐसे ही है, इस पे ज्यादा ध्यान देने की जरूरत नहीं है, और ऐसा ही मोस्टली होता भी है, खास करके ग्राउंड लेवल पे। जैसे कि जो फैमिली होते हैं, जो इवन फादर होते हैं, वो बहुत ज्यादा मदर की मेंटल हेल्थ के ऊपर काम नहीं करते हैं, बहुत ज्यादा ध्यान भी नहीं दे रहे होते। एंड देन जब अपन समझ लीजिए कोई एनजीओ है उसके ऊपर काम कर रही है, उनके पास में जाती है, बट स्टिल वो उसके ऊपर जो इतना प्रभावशाली ढंग से काम नहीं करते हैं, बहुत अच्छे से ध्यान भी नहीं देते हैं, और वो किसी न किसी प्रकार से उनकी मदर को इम्पैक्ट कर ही रहा होता है। तो इस चीज में कैसे जो तो हम मदद कर सकते हैं, उन्हें समझा सके कि वो लोग बिल्कुल ही ध्यान नहीं देते हैं, बिल्कुल इस चीज को सीरियसली नहीं लेते हैं, उनकी मेंटल हेल्थ को, देन उसके बाद में हम कैसे उनकी मदद कर सकते हैं।
That's why we are doing this free webinar, because इंडिया में स्पेशली मेंटल हेल्थ का जो स्टिग्मा एसोसिएटेड है, सिंपली मतलब मेरे रिलेटिव, इफ आई से माय रिलेटिव्स, मेनी ऑफ माय रिलेटिव्स आल्सो देयर आर सर्टेन मेंटल हेल्थ इश्यूज विद द मदर। इज एन एजुकेटेड पर्सन, इफ आई टेल हिम कि मेंटल हेल्थ इशू, इज नहीं नहीं, लाइक कहते हैं ना किसी की छाया आ गई है, झाड़ फूक कराएंगे
हम्म,
तो दैट इज द थिंग। एंड प्रेगनेंसी में स्पेशली फादर्स को आई टेल, आई हैव रेड समवेयर, अगर सपोज अ फादर वाइफ इज प्रेग्नेंट एंड किसी आदमी ने बोला अरे यार मेरी वाइफ प्रेग्नेंट है, मुझे बहुत स्ट्रेस हो रहा है, मैं क्या करूँ कैसे करूँ, तो व्हाट विल पीपल से? अरे तू पहला आदमी तो नहीं है जिसकी वाइफ प्रेग्नेंट है, तुझे क्यों एंजाइटी हो रहा है, तुझे क्यों स्ट्रेस हो रहा है, तू थोड़ी प्रेग्नेंट है। दिस इज
हाँ।
द लाइक वी गेट, नॉर्मली हमें यही बोला जाएगा, बिकॉज पीपल आर नॉट अवेयर ऑफ दिस। दैट्स व्हाई वी आर ट्राइंग टू क्रिएट द अवेयरनेस हियर कि आप क्या क्या इश्यूज होते हैं। सी व्हेन आई हैव started doing my perinatal mental health, truly speaking, during my pregnancy I was also not aware of many of the things, but when I did my course for perinatal mental health therapist, came to know so many things. Same way now we are trying, why we are conducting free webinars and why the workshop is free. Sorry, the workshop is free because एटलीस्ट फ्री है तो लोग आएंगे, कुछ तो पूछेंगे, कुछ
हम्म,
कहेंगे। पैसे हर कोई नहीं देना चाहता बिकॉज सोचते हैं कि फेक है, जस्ट मनी मेकिंग थिंग है। बट फ्री
हम्म,
एटलीस्ट कम एंड डिस्कस योर प्रॉब्लम्स, देन यू विल रियलाइज कि ये चीजें सही है, वेदर वी ट्राई टू मेक देम अवे कि ये सब होता है प्रेगनेंसी में, इट्स नॉर्मल। प्रेगनेंसी में देयर इज अ टर्म नोन एज फॉरगेटफुल ब्रेन। औरतें भूलने लगती चीजें, चाबी कहाँ रख दी, वो किचन में गए थे भूल गए। इट इज बिकॉज ऑफ द प्रेगनेंसी हार्मोन, या किसी को पता ही नहीं होता है ना। तो ये सब चीजें, दैट्स व्हाई वी आर ट्राइंग टू क्रिएट अवेयरनेस। 21 में ही डब्ल्यूएचओ ने गाइड लॉन्च की है, बट दिस थिंग इज नॉट 2020, दिस इज फ्रॉम वे बैक। बट पहले के जॉइंट फैमिली में सपोर्ट होता था एक लेडी के साथ, मोर वी आर कमिंग इनटू सिंगल फैमिलीज, वो सपोर्ट जो वुमेन को प्रेगनेंसी में मिलता था वो खत्म होता जा रहा है। दैट
हम्म,
थिंग्स आर कमिंग अप। एंड वेस्ट में पीपल लाइक ऑस्ट्रेलिया हैज अ प्रॉपर कोप, सीओपी करके कोप पूरा उनका एक सॉफ्टवेयर है, वहाँ पे ऑनलाइन औरतें जाके अपना मेंटल हेल्थ असेसमेंट भी कर सकते हैं। तो वेस्टर्न कंट्रीज हैव ऑलरेडी डेवलप्ड एंड दे आर वेरी फार इनटू ऑल दिस थिंग, बट ऑफ कोर्स हमारी कंट्री में अभी भी मेंटल हेल्थ को कोई नहीं ज्यादा पूछता, तो पेरिनेटल मेंटल हेल्थ तो इट्स अगेन अ
हम्म,
वेरी far away thing, right? So we are just trying to create awareness, jitna we will be able to do. And many like हमारे India में भी बहुत जैसे Nimhans, if you are aware of Nimhans,
Yes, ma'am.
it's so they have also started a perinatal mental health course. And
Hmm.
many hospitals, they have counselors and psychologists who give pregnant women counseling and advices. So
Hmm.
now we are improving slowly, but it will take some time.
Yes, ma'am.
There we go. Right?
Okay. Thank you, ma'am. Thank you so much,
Thank
ma'am.
you. Thank you so much. So I'll end the section here. Thank you.
Okay.